Hi everybody. This is Nityashri. I'm a pre-doctoral fellow at the Institute of Public Health in Bangalore, and welcome to the 10th webinar of the Equilogues webinar series. Today, the presentation is by Dr. Upendra Bhojani, who is a faculty at the Institute of Public Health, Bangalore, and a Wellcome Trust DBT India Alliance Intermediate Fellow. He graduated as a dentist and did his postgraduate and doctoral degree in public health. He has been with IPH for over 10 years now and currently leads a cluster on chronic health conditions and public policy. His research and advocacy interests include non-communicable diseases, tobacco control, intersectoral actions for health, health equity, and governance. Upendra led the India part of a multi-country collaborative project called Socially Inclusive Cities Network that aimed at building local network of researchers, practitioners, and policymakers, which can address social inclusion of ethnic and religious minorities in public services. The seminar today is titled Inclusion of Minorities in Public Services in India and is based on the Socially Inclusive Cities project. Now I will hand it over to Upen, who will start with his presentation. And please feel free to type in your questions into the chat box and I'll moderate them at the end of the presentation. Thank you.
Thank you, Nityashri, and I'm very happy to have this opportunity to be able to present this webinar as part of the Equilogues series. As Nityashri mentioned, what I'll be doing is, as part of this webinar, I'll be presenting to you a synopsis of a project called Socially Inclusive Cities Network that I had an opportunity to coordinate. This project is really a broader collaborative project with other partners in Asia, Africa, and Europe. And this was a GCRF funded exploratory initiatives and the aimed at establishing a network or promoting a network of people, of researchers, policymakers, practitioners, and academia who are interested in working in this area of enhancing inclusion of minorities. And there was a particular focus on looking at ethnic and religious minorities because this remains the groups we have very little evidence available globally, and their inclusion in public services. And when we say public services, the partner institutes decided to focus on these 4 domains, which is education, health, governance, and police. Now, early on in the project, which was 1 year long, we realized that there is hardly any published material available in our country around police services. So we had to unfortunately drop that. However, we added an additional component of inclusion of minorities in government sector employments, because that's an area where we have long-term reservation policies in the country. So the idea of this network was to review the available evidence at the country level in the partner countries using different kind of means, and at the end to come out with some sort of research strategy for the future research agenda for people who want to work or are working in this sector. Now, given the limitation of the time I will have today for this webinar, I won't be able to go into all the details of the project. However, there is a project web page, and I have mentioned a web link here that will take you to a page on a Leeds Institute of Health Sciences, which is a part of the Leeds University. And those of you who are interested can get further details from this web page, including being able to download the country level reports. So with that, let me focus on what we did as part of the India component of these exploratory initiatives. So we started by conducting a scoping review of literature, where we looked at published as well as grey literature, trying to understand how minorities are defined in India. What are the drivers, what are the major drivers of their exclusion from public services? What sort of inclusive policies exist? And what sort of evidence do we have today about the impact of these policies on inclusion of minorities? The second part was to conduct a series of consultations with stakeholders who are working in this area And unfortunately, because of the resource constraints, particularly of finance and the time, we could not focus at a national level for this component. And we rather did a series of 3 workshops at a state level in Karnataka, where we included various stakeholders working in this area and trying to get their comments and their reflections on what is it that literature had to say, as well as their critique and their own experiential insights on some of these issues. At the end, once we had kind of a project report, we used it to make outreach visits to a limited number of stakeholders at national level. And this mainly included some of the civil society organizations, as well as relevant government agencies, agencies like National Commission on Minorities, National Commission on Scheduled Tribes, as well as various relevant government ministries. So with that, let me come to some of the major findings. So who are minorities? The term minority often has very varied interpretations, some defining minorities as groups with smaller in numbers, smaller in size compared to the other groups in society, while some others define minorities irrespective of the size of the groups as social groups that are less privileged, that have lesser voice compared to other dominant groups in society. Indian constitution uses and mentions the term minority, particularly the linguistic and religious minorities. However, it doesn't really define it. And so we don't really have a legal definition of minority in India. But for official and the government purposes, minorities in India are the social groups who are designated as minorities by minority commissions at national and or state levels. And as we can see that while there is no clear criteria in defining minorities, the National Commission and the state commissions on minorities have defined Muslims, Christians, Sikhs, Parsis, Zoroastrians, and you can see that generally it's been religion and the size of these social groups, particularly with reference to the national level distribution. That seems to be a guiding criteria. And there also have been other state identified groups for affirmative action. So these are largely religious minorities. In terms of ethnicity, India also exhibits a rich ethnic diversity. However, ethnicity doesn't seem to be a dominant lens that has been used by researchers, but also in official parlance. But let's look at some of the groups that Indian constitution identified early on as groups who require affirmative action. And this include scheduled castes. These are the lower caste groups within the Hindus, but also lately including socially oppressed groups within Buddhism and Sikhism. These are the groups that suffered inhuman practice of untouchability, and they continue to suffer social oppression in society. Here we need to note that the study shows that how other religions like Islam and Christianity also shows social stratification, and particularly some of the people who would have got converted into these religions, they kept sort of facing exclusion based on these identities. However, they are not really included in scheduled caste category. Then there is a category of scheduled tribes, which largely includes many indigenous communities, including forest-dwelling communities, who are identified for affirmative actions mainly because of their geographic isolations, and that's why sort of discrimination. And these communities do constitute ethnic minorities in India, while there are, of course, many other groups who can be classified as ethnic minorities. But for the project purposes, we mainly focused on scheduled tribes. Lately, another group called other backward class was defined, which basically bringing together several other social groups who face social backwardness. However, unlike scheduled caste and scheduled tribes, there wasn't a defining criterion really for this category. While it is very visible that several social groups categorized so have been facing social oppression for a long time, in our country, we need to note that many of these classifications, and particularly later editions, were not really based on any large empirical surveys looking at the social disadvantage. And there also has been several editions of social groups into this category with a very rare deletion. Some also argue that political appeasement play out in the politics of reservations. And the studies also show how the communities who gets classified into these categories often also face stigmatization in society. So with that, what I'll now do is to go into specific domains of different public services and try to highlight what kind of inclusive policies and the evidence around impact of those policies we have today. Okay, sorry, I think before I jump into that, let me cover one more aspect, which is the major drivers of exclusion. So there has been several factors that have been mentioned in the literature, which leads to social exclusion of minorities. I will rather focus on some of the major theoretical constructs or the frameworks that have been used by researchers. So the India Exclusion Report mentions two major factors. One, the institutional bias, how public institutions behave differently with different kind of social groups. So the social norms that leads to social exclusion often gets reproduced in our public institutions. And one can see, and one can take an example of, say, for example, there has been caste-based discrimination within health workers, right? Similarly, the other major factor has been what they call unruly practice, meaning that poor implementation or suboptimal implementation of the rules. And so this leads to inadequate provision of public services by these institutions. The report also talks about the three sets of vulnerabilities, and this is in particular context of urban India and the marginalized groups within urban India. They talk of residential vulnerabilities, meaning that these groups often reside in areas which are hazardous and which exposes them to a significantly higher risk of, say, eviction, of diseases, etc. The social vulnerabilities because of the ascriptional identities, as well as occupational vulnerabilities. Many of these groups often work in very hazardous occupations, often in informal and seasonal labor. Literature also points out to several major factors that leads to social exclusion of Muslims from public services, starting from more historical bias after the partition in India, but also study shows that how Muslim society is not a kind of a monolith as it was thought to be, and there has been a lot of social stratification along various lines, whether it is of origins, whether it is of conversion from other religion to Islam, and many such factors, often leading to a caste-like structures within the society. And on top of it, of course, there are other issues of lower educational sort of indicators, as well as the physical segregation in terms of residence that also drives their exclusion from public services. For scheduled tribes, some of the major issues that come up in literature includes that these communities have been seen as outsiders, outsiders of the mainstream linguistic and religious society. And so there has been a tremendous limitation in terms of their familiarity and interactions with the prevailing public institutions set up in mainstream society. And there has also been a lack of a very strong political identity, a political tribal identity. So for example, unlike in case of scheduled castes, where even though they come from different religions, they generally have suffered similar kind of social oppression. And you see a very strong voice, a collective voice of Dalits, but that's something that we don't see much in case of scheduled tribes. There are very few national level political leaders who come from this community, because the community also is very isolated, physically isolated, and socially very heterogeneous. And those are sort of the possible issues that has not allowed such kind of a political identity to develop. People also mention about the Adivasi worldview and the values, because in most of these cultures, collectivity is very much revered. But for the kind of public institutions that have been set up, often one needs to have a kind of individual merit-based, very competitive kind of a spirit, and that's something that defeats kind of Adivasi worldviews. Of course, there has been increasing focus in literature on importance of intersectionality, meaning that many of these identities or the drivers of social exclusion we discuss often coexist and leads to a very different and perpetual form of exclusion. And we can take an example, say, a case of, say, a Dalit woman living in an urban slum in an Indian city and possibly employed say in construction work where there is no formal social security. So many of the drivers of social exclusion come together in a single lifetime. Now, as I said earlier, let's go into specific domains of different public services, and I'll start with education. So there has been a long-standing constitutionally guaranteed reservations in higher education, where especially in public funded institutions, there have been a reservation for admission into the courses in higher education institutions for SC, ST, and OBCs. And there have been some empirical studies, and with a bias that many of these studies have only looked at engineering institutions, or rather only the technical institutions, and not really a broad spectrum of higher education institutions. And studies look at three specific aspects while evaluating the impact of these policies. One, they look at the targeting, meaning whether who are benefiting out of these policies. And the studies clearly indicate that there has been a better targeting, in a sense that the students who are getting admissions on a reserved category often come from poorer households, and they come from poorer districts of India compared to general category students. However, this targeting seems to be better in case of SC and ST categories, and not so much in terms of OBC category, where there has been quite some documentation of how there has been concerns about more wealthy people within this category, or what is often called creamy layer in the category, capturing the reservation benefits. And this means there is also a higher political cost for this category, because many non-OBC people often feel that they are being disadvantaged because of this reservation policy. The other thing which is very much clear is that across all these categories, there has been a big gap in terms of gender. So more men are taking advantages compared to women. And similarly, a gap in terms of socioeconomical class, but also the location. People in urban area are often taking better advantages of these reservation policies compared to rural India. And so there is need to somehow account for these factors in implementing the reservation. And there has been some attempts. For example, till recently, a PhD admission process in Jawaharlal Nehru University often accounted for some of these factors beyond just the fact that somebody is from a particular reserved category. The second aspect one can look at is the catching up. So once students get admitted, how well they progress throughout the course compared to the general category students, and whether they are getting enough support. And there has been a clear evidence that they often find it difficult. Generally, the progression is slower, and that's mainly because of the poor implementation of some of the coaching schemes. So University Grant Commission has various schemes in place, which means that these institutions need to provide additional coaching, but also coaching for competitive exams. But this scheme implementations remains very suboptimal. And finally, studies also look at whether these students can timely complete the courses, and whether there has been any wage discrimination in the markets once they go out for the jobs. There has been quite a mixed evidence, with many studies indicating there is no real wage discrimination in the markets, while few studies also indicating that because of the reservations, some of these candidates gets into very highly competitive subjects, but once they graduate, they don't really earn well compared to others. So I only talked about the reservations in higher education. In last decade, there has been enactment of Right to Education Act, right, which mandates compulsory provision of free education for children from class 1 to 8 in government schools. But it also mandates that the private schools reserve at least 25% of the seats in the class 1 for admission of children who comes from weaker sections of society, and provide them free education until class 8. However, some of the early evidence shows that there has been a big gaps in implementation of right to education law. There has also been what is called Prime Minister 15-point program for minorities, where there are several measures for minority communities, and a couple of them are particularly about education in terms of providing better support to improve the educational infrastructure, but also provide scholarships to the meritorious students within minority communities. However, we didn't really find any published literature evaluating these schemes. The workshop participants often highlighted that there is a lack of awareness about these schemes among communities. Now let's go to another domain, which is governance. And we interpreted governance in a very limited sense. I'll talk of two aspects of it. One is about government, the one who governs. And there the Indian Constitution provides reservation of constituencies for candidates from SC and ST communities for contesting elections at all the three levels, at the local, state, and national level elections. And the available studies, well, later on, there was also a constitutional amendment that made provision for reserving about 33% of constituencies for women candidates at local government level. Now, many available studies indicate that there is a positive redistributive effect of this measure, meaning that in the constituencies where there is a reserved category candidate, in that tenure, you have seen a clear reduction in the poverty, not only for SC and ST groups, but also in general for those who are poor. So one can say that this measure is in generally a pro-poor measure in our country. There has also been study indicating how the reserved categories candidates, when they get elected in ST constituency, there is generally an increase in target spending on tribal welfare programs, right? But what is clear is that this redistributive effect, particularly reduction in poverty, seems to be more associated with reservations in elections for SC and ST candidates compared to that of women candidates. And it is observed far more commonly in rural constituencies compared to urban constituencies in India. There are also some sort of reservations having to some improvement in intergroup relations, right, in society, where there has been much more appreciation of social sort of oppression and need to sort of work towards it. But then there are also studies saying that, skill stereotyping do persist for people who come from these categories. The second aspect of governance is rather sort of subtle but important. Many workshop participants highlighted how the social norms, which often leads to social discrimination minorities, is important, and the public service provider come from the same society, and so you also see that reproduced in public service provision, meaning that it's important that the people from minority communities get represented well in these sectors, right? And in that respect, it is important that the Constitution in India provides reservations for jobs in government sectors for people coming from these reserved categories. However, unlike reservations in earlier domains that we talked, there has been quite a resistance in implementing reservations in employment. So much so that, institutions like Delhi universities resisted implementing reservations in employment until 1990s. And even when the public institutions implement these reservations, they have been using a different kind of methods from the one which is prescribed. Some of them, for example, use what is known as promotion-based and post-based sort of reservations for employment, as against creating kind of a clear quota-based reservations of the available vacancies. And this means there is further disadvantage to candidates coming from SC and ST category, because then reserved seat takes years together for opening up for recruitment of people from reserved categories. However, some of the documentation available shows how formation of teachers associations coming from SC and ST category in the higher education institutions, but also in public sector jobs, as well as the use of social discrimination audits as a tool have been very useful in sort of highlighting and sometimes countering some of these kind of discriminatory practices in public sector entities. Let me come to sort of a last domain that I'll deal today, which is health services. Now, unlike kind of other domains we talked, there is not really any legal entitlement for health services in India. The Indian Constitution doesn't recognize right to health as a fundamental right. And so there is no consequent legislation which guarantees right to health. Though various court judgments in India do highlight and interpret right to health as being integral to right to life and right to personal liberties, which are recognized as fundamental rights. We also notice that there is no specific policies which is aimed at enhancing inclusion of minorities, and particularly religious and ethnic minorities, in health services. However, having said that, there have been several measures which are in general targeted to marginalized sections of society, and particularly those living below poverty line in health sector. And one of the main inclusive measures has been, particularly in the last decade, that has gained a lot of prominence, is the financial protection for poor. Large-scale health insurance schemes funded by governments, be it Rashtriya Swasthya Bima Yojana or now the Ayushman Bharat, but also many state governments have their own government-funded health insurance schemes. The available studies generally indicate that there has been a substantial improvement in terms of health insurance coverage for poor in India, and though it is not enough, there is a long way to go. These schemes have not been able to bring about a significant reduction in out-of-pocket payments and impoverishment related to seeking healthcare services in India. There has also been some evidence that the efforts by governments at enhancing the participation of communities in health services management, planning, and particularly monitoring of health services have led to some positive results in terms of enhanced availability of healthcare services in government facilities. Finally, there has been some documentation of very limited models attempting to sort of converge provision of health and social care for excluded groups. But this is very limited, mainly in urban India. You see it in form of, say, shelter care and things like that. Interestingly, we also came across some of the examples in health, which one might call an example of adverse inclusion, meaning that you try to include minorities and other excluded groups, but at an adverse term. And so it may not lead to the desired benefit to them, but in fact, sometimes can do harm to them. In India, there has been quite some ethnographic sort of evidence on how underserved strategy of polio immunization program, or what is called very intensified outreach of polio immunization program in few regions of Uttar Pradesh in wake of making India polio free, led to overdosages of polio vaccines to children in certain communities, often leading to vaccine-related polio cases, but more importantly, leading to a lot of distrust between communities and these health programs. Similarly, there has also been some example in Madhya Pradesh, say a scheme that intended to provide emergency transport services to women staying in far-flung rural areas for childbirth services. And the evaluation shows that while women utilized such ambulance services, they didn't really benefit in terms of reduced travel time compared to use of public transport. And this can be because of various reasons, including the fact that often ambulances arrive very late to their doorstep. So at end of the literature reviews, as well as the consultative exercises in forms of workshops, but also in forms of outreach visits to some of the higher ups in relevant government agencies, what we did is we developed kind of a research strategy. And I have absolutely no time really to go into this, but what I'll do is I'll provide you a last and final slide just to provide an outline that when we talk of research strategy, we talked of three major sections. At the top, you can see we identified that how there are certain concepts that need to be very much clarified at outset for researchers who are interested in researching into this area. We also highlighted, as you can see in the middle part, the blue part, various methodological implications that one has to be aware of, and the kind of methods that might be preferred while doing such kind of research inquiries. And in the end, at the bottom part of the slide, you can see we also identified some of the research areas or the research thematics that needs to be prioritized in terms of research inquiry as far as these four domains of health, education, employment, and governance are concerned. So with that, I come to the end of this webinar. I hope I was able to provide you a brief sort of peek into the kind of exploratory work we did as part of the Social Inclusive Cities Network. And I'll be very happy to be able to take your suggestions and comments and possibly respond to some of the questions. I hand over this to Nityashree now.
Thank you, Upen. Thanks for the wonderful presentation. It was interesting to hear about the inclusion or rather exclusion of minorities from public services in India. We do have a few questions from a few of the listeners, but before that, because you spoke about public services in India, I wonder if similar studies exist for inclusion in the private sector. Is there any sort of data available for that?
Yes, thank you, Nityashree, for highlighting this. So in most of the areas, these reservation or affirmative action policies by Indian state only applies to the government sectors, right? Unfortunately, but as we can see that in many of these public service provision, the private sector now plays really a dominant role. I mean, if we see nearly 80% of India's poor actually seek healthcare services from private sector. And so this clearly appeared as one of the big concerns during our consultative meetings. There was very little literature, maybe for the reason that there is no such policies in private sector, but there were a lot of commentaries that lamented on the need to bring private sector under this net of affirmative action policies in terms of employment and the other issues. There has been some, as I said, recent evidence around right to education, because this particular act does include private schools, right, where the private schools are supposed to provide at least 25% reserved seats for children in class 1 and provide sort of free education to class 8. And there have been issues of the various barriers that sometimes schools put up in really sort of admitting such students, and also documentation of the issues that these students face by being in some of these elite schools in their journey. But that's more of a sort of a recent evidence. And that's the reason why one of the major thematics that we prioritized in our future research agenda, which we also hope to use to advocate to the policymakers and the funders who fund such kind of work in this area, is to look at private sector and what the role private sector plays in sort of inclusion of minorities in public services in India.
Thank you. So now we can take questions from participants here. We have a question from Tanya who says, social exclusion and social inclusion are two ends of a spectrum. Most schemes that target are attempting to specifically include a certain group. Could you explain about efforts from the government or within a particular public service to reduce drivers of social exclusion that you mentioned?
Yeah, actually, I think in our project meetings, particularly with partners from different countries, we had a lot of conceptual discussions on social inclusion and inclusion, as if, I mean, are they really separate in terms of when you want to approach sort of either addressing or. So it's really an interesting question. Much of the government initiatives and policies have been more of an affirmative action, meaning that have been to try to include people who have been recognized as being excluded because of various reasons. But like Tanya said, I think there has not been much sort of explicit attempt in terms of addressing the root or the root causes of social exclusion. And that's where you also see a lot of critical commentaries on reservation policies, where while even those who generally believe in positive impact of reservation policies, clearly see the limitations, because that seems to be more of a curative kind of a clinical kind of an intervention, rather than really addressing the social ills that in the first place exclude them. And maybe that's the reason why over years, for example, you see that ST communities, for example, have not benefited as much in their own rights, but also in comparison to SC communities out of reservations, where many of the ST quotas often go unfilled, whether it is about admissions, whether it is about employment, etc. And some of the researchers highlight how this is because these policies do not really address the core social exclusion drivers faced by these communities. Yeah, and I think we came across some examples that I mentioned in the report, which may not be necessarily by the government initiatives, and I did not cover it in my presentation today, mainly because of the time constraint, but I could have otherwise put up a separate slide where we can also talk about initiatives by non-government agencies, right? And I would highlight at least few strategies that have been used. Either there has been community-led and NGO-led actions in various forms, be it promoting self-organization of people from these communities. And we had an excellent case study shared by an indigenous community leader from Karnataka about how self-organization of the community helped a lot in addressing some of these exclusion drivers, right? We also had some examples of using public interest litigation, for example, as a way. And nowadays you see this discourse in media a lot, whether it is about entry of women into temples or many other issues where courts are taking sort of proactive stance. So public interest litigation seems to be another critical tool that has been used to address some of the drivers of social exclusion. And finally, there have been some administrative tools, may not be legislative tools, things like, say, social development plans. So there have been targeted budgeting and targeting actions on certain kind of issues which are known to create social exclusion. So I don't know whether I really answered the question, but that's what comes to my mind.
Thank you, Upe. We do have some follow-up questions to that. Yeah, Tanya says thank you. I think you've answered her question. But Yogesh asks, thank you, Upen, for the wonderful presentation. I'm curious, have you looked at the process of social exclusion? For example, how Adivasi community is excluded from right to education? Would you like to elaborate on that?
Yeah, we did look at scheduled tribe category as an important focus while looking at the literature. But what we realized that in general, we didn't come across many much of published literature, especially around right to education. Maybe it's a relatively sort of recent reform, and so there are not really many evaluative study as such. But we did come across some of the commentaries and sort of perspectives highlighting the issues faced by, say, children coming from ST community and trying to sort of get into private schools. But I must highlight some of the limitations of these sort of work that we did as part of the network, which also puts me in position not being able to answer some of these questions more specifically, is that I think the very definition we started with, which is of social exclusion for this project, which is that, exclusion from certain public services, is in a sense limited, because it makes social exclusion as if it is a quantified phenomena of whether you received or did not receive the service, right? But the social exclusion is as much about the outcome as it is about the processes. So one would have received the service, but would not have received service of quality, or would not have received services with dignity and respect, right? So I think that's where I think the way we looked about literature was very limited. Also, the time was very limited, and many of these issues, including the one that Yogesh highlights, we mainly just had comments and kind of experiential insights by people who were part of our consultative workshops. So we had some stakeholders who were like civil society organizations who are particularly advocating to implement Right to Education Act. And they were highlighting various challenges that they have. My gathering is that many of the challenges there currently lies at rather the level of the state governments and the educational institute level, where many of them have not been able to sort of put in place a very transparent mechanism of how they do these admissions, right? Of course, there is also an issue that the schools don't proactively advertise, and there has not been a strong mechanism in place that makes it possible for communities to be well aware of nitty-gritties involved in seeking advantage in the right to education.
Okay, thank you for that. We have a question from Apurva Kumar, who asks, how can the social determinants of health discourse be integrated into the health policies and, more importantly, within the health workforce? As Professor Sanghamitra Acharya in her research has shown that community health workers of dominant caste have discriminatory behavior vis-a-vis the SCs. Will sensitivity of some kind work?
Well, it's a very complex issue. Um, uh, I can only make few remarks that I sort of gathered in my short work. I think one thing I can highlight is that um, the what I mentioned in my presentation about the social discrimination audits. So this became a bit of a commonplace. It's not still very mainstream practice, but the fact that the teachers in higher education institutions started getting organized, particularly those who were from these reserved categories, gave them a bit of a collective voice. And they started popularizing this tool of social discriminatory audit in public institutions. And at least that served a kind of a mechanism that highlighted kind of discriminatory practices that happen to students, but also to employees, right? We have not really seen such processes happening that much within health sector per se, because I think you particularly brought up the health sector. And I was involved to some extent in the whole process of community participation under National Rural Health Mission in past years, and I also saw what you mentioned about Sanghamitra's work, right? How healthcare providers sort of often discriminate with users of the healthcare services, and that remains a stark reality. So maybe such kind of tools. Also, there has been a different, there has been a nice sort of review of interventions within public services, including health domain, by Public Affairs Center, which documents a kind of tools that can address the kind of issues you mentioned. And this often includes things like equity monitoring by community themselves, by things like budget tracking and monitoring, because I think we had a senior officer from a department of social welfare from government of Karnataka, and he was highlighting how while they have a legislation in place, and based on that they have a nice mechanism where they make specific budget allocations for SC and ST welfare as part proportionate to their population share, and these budgets need to be used only for services towards this community by various departments, and that's how the main budget gets sort of allocated. But he did mention that, you know, while financial allocations are happening, there is no way really to systematically track that when once the budget gets allocated to specific departments, which are service delivery departments, like say health, whether that budget share is really used only targetedly for SC/ST community, and what has been really the impact. So those are the questions he himself was sort of flagging out. Finally, may not be directly relevant to the issue that Apurva mentioned. I see that in my own work, the new approaches which are often called, say, health in all policy, a kind of an approach. Uh, it's not new concept, but I think some of these, particularly say health involved policy, has been more operational concept than the social determinants of health. So I think this kind of concepts actually clearly drives multi-sectoral action, and that drives how different sectors can prioritize health within that. Yeah, that's what I think I have to say for now.
Thank you for that. Okay, so now we have a question from Tanya who asks, what was your experience of looking for research on social exclusion within public services in India in terms of the focus, methods, and actors?
Okay, so I must confess that I was not a core researcher in this area, right? When I started a scoping review, and the review that's why what we did was also of a scoping in nature, meaning that the kind of literature review we did was not meant to be a very exhaustive and kind of authoritative exercise. It was rather to scope what sort of literature is available, and based on that, let me try to answer the question. So one thing, so what I found is that despite this long-standing affirmative action policies, let's take the case of reservations in some of the sectors, I was amazed that there's very little empirical literature which uses methods which are appropriate to let you make some judgment on the impact of these policies. Now, partly it may be an issue of the methods, because it's very difficult to probably link up the outcomes with this broad mandated policies, because there are so many other variables that would probably operate. But still, that's one area that starkly sort of came out, that one, there is very limited literature that actually empirically look at the impact of these policies, while there's humongous literature that really was more in form of commentaries, perspectives, and ideas around the reservation policies, whether they are good or bad, and whether they, how best they can be done. There was very limited literature looking at it. This is despite the fact that there has been methodological advances, and there has been a lot of mention of things like intersectionality, which can help you go beyond sort of. But we didn't really see these kind of methods being applied in the very few studies available that we could see. So that's one. Other thing I also noticed was a kind of limited spaces, because the nature of this subject, which is so cross-sectoral. I mean, so it's sector agnostic in a sense, and so it's not easy to find where such literature might lie, right? And it's interesting how some kind of journals were throwing up a lot more relevant articles than many others. So just to mention, for example, while we used many different data sets, which are search engines basically helping you look at a bunch of journals, there was one journal, this Economic and Political Weekly, that stand out in terms of its contribution to the relevant articles in this domain tremendously. So I think, yeah, those are some of the remarks that I had in terms of the literature and kind of, and the issues which are being addressed were also largely, as I said, around the reservations, because that has remained a long-standing sort of an area of interest and depth. Many other issues has not really come to fore. Also, many of the studies, that's why focused on these categories of SC, ST, OBC, while of course, as part of our exercise, and as any Indian would readily recount so many other social groups who face vulnerabilities and who can be considered minorities, particularly when you say minorities are the social groups who don't have enough say in society. And so one of the things we highlight in research strategy is also to say that there is really need to go beyond the known settings and the social groups that are being researched. Not to say that you do need to research them further, maybe using different kind of methods, but you also need to talk about many other groups who have received very little research attention.
Thank you for that, Upin. And I think the health equity research initiative took some steps to take this forward, to talk about which groups and what kinds of research are necessary at this point in time. That will surely give young researchers a better idea. Okay, we have an interesting question from Anushri here who asks, have you looked at within caste discrimination, so as a sub part of social exclusion, in particular with healthcare access? So I think she's talking about intra-caste discrimination.
No, we really didn't look in detail of that, because partly because of the broader sort of mandate and focus of the initiative, as I mentioned earlier, that the idea was really to try to highlight more the issues related to ethnic and religious minorities. And that's where, I mean, caste-based discrimination and intra-caste sort of groups differentials have been kind of a known phenomena, and I guess requires a lot more work. But given that did not readily fit into either an ethnic lens or a religious lens, and there has been relatively more work done around that compared to the work done around, say, religious minorities. And I mean, there is very little we actually found around religious minorities and health services, say, for example. So we really didn't look much into that. And just also making a remark on your earlier statement, Nityasri, I really appreciate, and I have been kind of a distant sort of participant and a fan of, so to say, of the Health Equity Research Network. And that's where what we did is that, because this was just a one-year initiative supported by GCRF. So what we did is we also tried to integrate this sort of small network that we created with this established network of health equity sort of research network. And I'm hoping that on the network website, you will be able to also find the project resources that I took today. Yeah. And also of the book, I think I must not forget that the kind of a book that also came out of the Health Equity Research Network, Health Inequalities in India. And I had kind of a privilege to moderate one of the book launch. And I went through much of the book. And I think for those who are interested in really making a deep dive into health inequities with comparison to health as a domain, I really recommend them to go through that book, because the book systematically goes through different socially disadvantaged groups and in domain of health. It also makes very interesting commentaries on the methods being used by research studies that link health with social exclusion in India.
Thank you. So now we have a question from Prashant, who says, conceptually speaking, would you see a difference between research on social exclusion and research on social inclusion? It's often said that there are two sides of the same coin, but do you have any thoughts on this?
Let me say, I won't be able to really make any sort of valuable contribution here, though we had some interesting exchanges around these concepts that I also mentioned earlier in some of our project meetings. One thing that I can say from my own sort of experience and look at some of this work and literature is that I think while it might there might be conceptual differences, what I can clearly see is the operational implications of research in these two areas. Because I think there has been tremendously more amount of sort of attention and literature in area of social exclusion, and not so much in area of social inclusion. And if we talk about research informing sort of real world, I think often what policymakers look at is kind of solutions for enhancing inclusion, right? And I think it might also be refreshing to also sometimes talk about things that work or things that actually help address the terrible things that we have been seeing in society. I think that's a challenge. That's a challenge because in our own scoping review, we found very little sort of research that actually talked about the possible models and kind of operational lessons of inclusive sort of approaches and policies, while there is of course a lot more literature that talks about what leads to exclusion and the consequences.
All right. So I think we are nearing the end of the webinar now. This is only a few minutes left. So thank you everybody for participating. Thank you again for the wonderful presentation. It was, and the discussion that followed was very stimulating. So that was, if anybody has any last thoughts, now is the time to write in.
Extension of an earlier question. Hi, this is just an extension of an earlier question. There was a question on intra-caste differences. My question is more on, you are aware of the political maneuvering between communities, like those who are excluded. Within themselves, there is a political maneuvering of oppression and assent. So it's a sort of a political happening. And that again reflects on the exclusion process for certain affected communities. That is one thing. Second thing, there is a paradox between communities itself as to whether they truly fall into an excluded community. Like, for example, we have been seeing this with the jet agitation in Rajasthan, the Patidar, this thing in Gujarat, though they claim to be excluded, but economically they are sort of something like a criminal. So, have these things been mapped in your exercise? Yes.
So partly some of this yeah, thank you for that interesting remark. Partly some of these issues did surface, and I completely agree with you that, and there has been documentation of some of these issues, um, uh, and and that's where I think there is quite some interest in the politics of reservation policies per se, right? That it is not, um, it is not simply kind of an instrumental measure. How, for example, there is some literature in Muslim communities that despite several Muslim leaders now in a prominent political positions, that has, whether it has really helped sort of enhancing inclusion of the of a specific community. And there you see this kind of politics where sort of how much of the political identity actually translates into community benefits, right? There is also a lot of talk about appeasement kind of a politics, which has also come up, and that's what probably also drives some of these say reservation demands by communities which are otherwise seen as sort of well-off communities in that social group. But I think this is something conceptually also is challenging, because I mean, you and me also face some exclusion, right? So in that way, the exclusion lies everywhere, right? And that's where the politics becomes far more important of exclusion, in terms of where do you sort of um, prioritize things. There are also a couple of other interesting issues that come up. Maybe I just take that as my last thought to mention. But the issues with established kind of systems that we have, where, for example, the migration came up another big important issue in this regard, because many of these affirmative action policies are based on the kind of categorization of people, and this categorization can happen as well at a state level. For example, the state governments can accord scheduled caste status to certain communities. This has been quite sort of a practice. And so when people have to migrate out of one state to another, they suddenly might find themselves losing kind of the reservation or affirmative policy advantage that they had in their states, right? So there have been quite a few other issues. Similarly, in terms of what kind of, if you think that number is one of the important factors that drives, say, minority definition in India, and that seems to be one of the factors, even though not very explicitly mentioned as criteria. Then whether it should be done in a national frame or whether it should be done in a state reference frame, right? And there has been uh, legally there has been a shift where minority commissions at state level can designate communities as a minority groups, and you would see, you know, that some minority communities in India, like say Sikhs, would actually form majority in state like Punjab, right? Christians would form majority of population in most of the north eastern states, or the Muslims form majority of population in Jammu and Kashmir, right? But then why it is really important to keep national frame, because that doesn't take away from the broader sort of social exclusion you face, so particularly in a very integrated sort of country like ours. So there were such other issues that came up, and I don't think we were able to do a lot of justice with that, except that we have brought out some of these remarks in the country report. So thank you. If that is the end of it, thank you to the people who manage Equilogues for this invitation, and look forward to sort of participating in this series further.
Thank you, Pen. Thanks everybody for participating. Yeah, we've ended well in time, so thanks everyone. We'll end the webinar now.